Warm congratulations to the Public Health Class of 2021. This year, like no other, has prepared you for the unexpected. It has taught you the value of teamwork and flexibility. It has proved that you are resilient and powerful. Thank you for what you have sacrificed this year for the good of the whole. I look forward to the good that I know you will do in the world.
I had a couple different majors in the School of Environment and Natural Resources before finding public health, and I've just loved every minute of learning about public health and especially the sociology side of things, and has really just grown my passion for loving and caring for people.
Hello, class of 2021. I'm honored to be among the first to congratulate you. As you've earned your degree, you've shown what it means to be a Buckeye. You've risen to this year's challenges with grace and resilience. You've shown compassion in how you care for the people around you. Your class is a reason for optimism. Together, you are the next generation of leaders, determined and well prepared to create a more vibrant future. Your ambitions and your passions have brought you to where you are today, and they will fuel your path forward. As you celebrate, consider the many people who have supported you on this journey. Let's thank the families and communities who have encouraged you, the mentors who have taught and inspired you, the supporters who've made your scholarships and experiences possible, and of course, the lifelong friends you've made. As you prepare for what's next, remember that you'll always have a community at Ohio State. You're part of the alumni family, a Buckeye for life, and that means you have one of the biggest cheering sections in the world. Congratulations.
Good afternoon, Dean Fairchild, faculty and staff, friends and family, and distinguished graduates. I have the great honor of representing the Spring 2021 graduating class of graduate students of the College of Public Health at The Ohio State University. I am Randy Johnnicon, a graduating Master of Health Administration student hailing from Atlanta, Georgia. If I have had the opportunity to introduce myself to any of you all throughout my 2 years here, I'm sure that I have made it a point to share where I'm from. And mainly, I do this for two reasons. One, to provide some context as to why I'm wearing my winter hat and coat in 50-degree weather, and the other is to open up the opportunity to share and reflect on how our different experiences have led us all to the common goal of wanting to create improved health for communities worldwide. So as I'm introducing myself to the majority of you all for the first time, let us all reflect on where we've been, where we are right now, and how we are going to make our impact in the future. So let's start with where we've been. In our past, I'm sure that we've all been through something that has inspired us to create the changes we wish to see in the world of public health. For me, I noticed that my community experienced disparate health outcomes when compared to neighboring communities, and this seemed unfair to me. This similar idea that we all carry in our hearts has guided us to establish our educational foundation during undergrad and pursue our graduate educational training here at Ohio State. And this is where we are right now. Through our collective passion and dedication, we've all achieved the remarkable accomplishment of being conferred a graduate degree from one of the best colleges in the country. Here you have interacted with diverse students who have become lifelong friends and devoted faculty who become lifelong mentors. Sure, there were times where we may have felt a bit overwhelmed, especially considering the unprecedented times that we are facing with the global pandemic. However, our tenacity and grit shine through thanks to the support of your fellow Buckeyes and loved ones. Please remember to thank them for the role that they have played in your lives. And finally, let us allow our past experiences to constantly remind us of our purpose and fuel our journey for our vision of the future. I hope that you will all cherish the memories that we made in our pursuit of education and utilize them to the best of your ability to change the world of public health. Though we may not see each other as often, each one of us has our own specific purpose in this journey, and collectively, we're the generation of leaders who are destined to make monumental strides in the advancement of health outcomes for all communities. I cannot wait to see how it all unfolds for us in the future. My hope is that when our grandkids ask us what 2020 was like, and we tell them how toilet paper became more valuable than the US dollar, they'll be proud of how far we've come. But for now, congratulations to you all, and go Buckeyes.
Good afternoon. Congratulations to my fellow graduates in the Ohio State College of Public Health. It is an honor to be speaking to you today. By the time this weekend is over, I'm sure we'll be tired of discussing the uniqueness of our senior year. However, as public health students, the concept of a global pandemic is especially profound. For these past 4 years, we have all been learning about epidemiology, spread of diseases, and community crisis response. Watching the pandemic play out, I'm not sure what future public health textbooks will say. The books, however, won't provide future public health students the very real human experience that we've lived through. How our local, state, and federal officials handled the initial pandemic response, the feeling each of us had last year on spring break when we received the email that we would not be returning to campus. While many of us would play in the community pandemic response. Many of us served as contact tracers, worked in the vaccine lines, and helped our community in other ways. Since June, I have been working 25 hours a week for Columbus Public Health, first as a COVID case investigator, and in February, I began registering community member vaccines. As people may have feared the dreaded call from a public health agency, I quickly realized that case investigation required patience, compassion, and a clear exchange of information in order to be effective. From helping parents navigate how to keep their children safe in schools, to family members worried about their grandparents, to hearing many COVID conspiracy theories, I've gathered a wealth of stories. I am now an expert at debunking rumors of microchips, 5G towers, and even claims that everyone from celebrities to top government officials created COVID in a lab. By having meaningful experience in public health before graduation, I have gained invaluable professionalism and confidence that I will carry on to my future public health career. While COVID brought uncertainty and fear into our past year, we have defined our senior year, not the pandemic. Future employers should note we've proved that we are flexible by shifting to online school halfway through an academically demanding third semester. We've proved we are tenacious as we rigorously applied for graduate schools and first jobs. We've proved we are resilient by thriving during a difficult and important year in all of our lives. The resiliency of our class reflects the degree of leadership our CPH professors and administrators have shown throughout the year. The communication and grace demonstrated during the pandemic from the members of our School of Public Health and our professors are truly appreciated by their students. To the class of 2021, let again be a reminder of how much you've accomplished. I am so honored to be amongst you, my fellow Ohio State graduates of 2021. Congratulations. Now, it is my honor to introduce you to Columbus Health Commissioner, Dr. Mysheika W. Roberts. At Columbus Public Health, Dr. Roberts leads a team of more than 500 public health professionals who are focused on neighborhood-based approaches that address the social determinants of health to mitigate health inequities. Dr. Roberts has a prolific 20-year public health background at the local, state, and national levels, including positions investigating outbreaks for the Center for Disease Control and Prevention and leading an STD clinic and hepatitis prevention efforts at the Baltimore City Health Department. Welcome, Dr. Roberts.
Thank you. Thanks so much, Lauren, and thanks for all you do, and congratulations. And good afternoon, everyone, to Dean Fairchild, faculty, staff, family, and friends, and of course, the graduates. It is truly my honor to be here with you today to recognize and celebrate you, the graduating students of the Ohio State University College of Public Health. Today is truly a special day. It's a special day for you, the graduates, as you celebrate the fruition of your hard work and the countless hours studying, the time that you've lost sleep and time with your family and friends, and the commitment and drive that propelled you to this very moment that we are celebrating today. It's a special day for your loved ones as well, as they all celebrate your achievements with great pride and admiration of what you have accomplished. And it's a special day for public health, as we all eagerly await your contributions that you will make as public health professionals in this world and a time that needs you more than ever before. You are graduating, as you all know and have said, at a time in public health. It's a unique time in history, a once in a lifetime pandemic, a worldwide pandemic. You are entering this chosen profession at a time when public health is no longer working behind the scenes to protect the health and safety of the community. Public health is now center stage. We are upfront and personal. We are in the spotlight as the world grapples with this COVID-19 pandemic. In fact, COVID-19 has really been an aha moment for public health in our community as well as around the globe. Everyone now sees public health. They understand it just a little bit more, and they are finally beginning to appreciate the value it brings, not only to their own health, but the health of the entire community. Even your grandmother now knows what public health is and what you can do with this hard-earned degree that you've earned. Yes, thanks to COVID-19, today's path to public health is much clearer and ever before in our lifetime. You have chosen public health because of COVID-19 or maybe in spite of COVID-19, but you've done so with determination and fortitude, and that is what has brought us to this day. You have willingly stepped up to serve in public health with your eyes wide open, with the realization and recognition of what it means to be a public health servant. And as health commissioner, I am truly grateful to all of you. So see, when I entered public health longer ago than I might want to admit, the path wasn't quite so clear. In fact, I never even considered public health as a career until one defining moment. And that was one spectacular basketball legend, Magic Johnson. So you see, I came from a medical family. My father's a physician, my mother is a nurse. So I knew as a young candy striper, I wanted to be a physician just like my dad. But I never considered public health as a career option. That all changed in 1991 when Magic Johnson announced to the world that he was HIV positive. That was a defining moment for me as a student, as a resident of Los Angeles, and as a lifelong Lakers fan. It really ignited my passion and changed the path of my medical career to public health. I like to believe that I've taken a few lessons from Magic over my career. And no, I cannot dunk. I can't even play basketball. I have no championship rings. And while we're on Zoom and you might not be able to appreciate this, for those of you who have seen me in person, I'm not very tall. In addition to inspiring me to go into public health, two other things come to mind when I think about Magic Johnson. First, Magic always talks about the value of a team. As health commissioner, I know I cannot do this work alone. I need my colleagues at Columbus Public Health who work tirelessly day in and day out to protect the health of our community. I need community leaders and partners like Dean Fairchild and the Ohio State University College of Medicine and College of Public Health. And of course, I need all of you to be a part of our public health team too. We are counting I am counting on you to help us create a healthier and more equitable community as well as a world. And the second thing Magic Johnson always says is, if you don't dream it, you can't achieve it. I couldn't agree more. At a young age, I took his advice to heart. I dreamed it and I achieved it. My dream was becoming a health commissioner. And now it is my responsibility to motivate other young public health professionals like you to dream high, work hard, so that your professional dreams can become a reality, just like mine did. In fact, you can and you must dream to create the very opportunities and future that you desire. Do not let stereotypes and what you are supposed to do determine your personal path to success. And believe you me, I know this firsthand. So who would have ever thought that a young 7-year-old girl who was terrified of people in wheelchairs would go on to become a physician? And who would have thought that a teenager who went to Marymount High School, an all-girls Catholic school in Los Angeles, would eventually lead an STD and HIV clinic in Baltimore, Maryland, in the middle of a huge syphilis outbreak? And who could have predicted that this same young lady would later become the first African-American health commissioner in the city of Columbus? In fact, at one time, I couldn't have even imagined that a University of Michigan grad from sunny Los Angeles, California, would be living in Columbus, Ohio, and would be calling myself a Buckeye. But experiences have taught me this: you cannot let your early ideas, experiences, expectations, and maybe even fears create roadblocks in your professional journey. You and you alone must determine your path and let your power as well as your passion to make a difference be your roadmap. I challenge you all to find your defining moment, just like I did with Magic Johnson. Seize that moment and use it to make a difference in public health and in the world you choose to serve. I think Mahatma Gandhi really said it best. He said, the best way to find yourself is to lose yourself in the sacrifice to others. I'm going to repeat that again. The best way to find yourself is to lose yourself in the service of others. So I ask you today, how will you serve your community through public health? Will you commit yourself to increasing healthier opportunities for people of color and marginalized communities so that they can live healthier and safer lives? Or will you choose to work to increase access to healthy foods, affordable housing, healthcare, and other social determinants of health so that all people have the choices they need to live, grow, and prosper? What can you do to address racism in your workplaces as well as your communities so that we can turn the tide on systemic racism that has had a grip on our country for hundreds of years? And how will you ensure that public health continues to meet today's emerging challenges like COVID-19 while working to address the root causes of some of the most pressing public health needs in our communities? You have a role to play, and we need your help. How you choose to help public health achieve these things is really up to you. There are so many roads you can take. So whether you choose to work as an epidemiologist to track the trends that public health practitioners use to monitor and respond to the needs of the community, or whether you choose to be a disease detective to identify and control outbreaks that threaten the public health and well-being, or whether you choose to be on the front lines of the public health response to COVID-19, Ebola, or any other new contagions that are bound to emerge, or whether you choose to be a health commissioner like me. If you dream it, you can achieve it. True public health leaders are all around us, doing ordinary things every day to make an extraordinary difference in the lives of all of us. As I celebrate with you today, I see more than individual graduates and future public health professionals. Collectively, what I see passion, I see promise, I see endless possibilities. And most importantly, I see hope. You are the hope of a healthier and more equitable community for all. Now, as your health commissioner, I can tell you that the challenges we face are complex and the work is difficult. It's not difficult, it's just hard. It will take all of us working together to get to the other side of this pandemic so we can address the other public health issues like addiction, crime, and mental health that have been overshadowed by the COVID-19 pandemic. We all need to roll up our sleeves and get to work. The work will not be easy, but the work will be worth it. Public health is everyone's responsibility, from individual choices we make to public policy and the roles that we choose to fulfill in our public health work. Together, that's you, that's me, that's all of us. We are a part of one team. As public health leaders, we can make a huge impact on these challenges that we all face, as long as we face them together as a team. As your health commissioner, I am grateful you have chosen to join our public health team. As I said before, we need you. Our community needs you. You have much to give and offer to make things better in your own corner of the world and in the greater community at large. As public health professionals, you are the promise of a better world, a world where the little Black baby born today in the inner city has the same opportunities and resources she needs to become anything she dreams of becoming when she grows up. A world where all children have healthy, fresh food on their dinner tables and safe sidewalks and green spaces to play, regardless of their zip code. A world where all kids have a safe home and a school where they can get quality education and make their mark on the world in a positive way. And a world where all people have the opportunities and healthy choices they need to grow, live, and thrive, regardless of the color of their skin or where they live. As public health professionals, we must be the change we want to see. We must continue to press for progress. And when we are tired and feel like giving up, we have to keep pressing. Together, we must motivate and unite our world in a way that builds up marginalized communities and gives all people the opportunity for good health. And this is the only way that we will create a healthier world for all of us. So as we celebrate your graduation today, I ask you all to commit to 3 things. First, show up. Make sure you are at the table and you are part of the conversation. And ensure that those who look and sound differently than you are also at the table too, right there beside you. We need your voice and a chorus of diverse voices heard in order to create meaningful change and positive impacts in our community. Second, have a clear vision. Look for the defining moments in your life, just like mine with Magic Johnson's HIV announcement so many years ago. Your defining moment will bring you clarity, and that will guide you. Find work in public health that fulfills you and positively impacts the community you choose to call home. And be willing to change your path in public health if necessary. Sometimes there's more than one route to your destination and that dream job. If you hit a roadblock, go over it, go around it, or go through it. Don't let anyone or anything keep you from fulfilling your dreams and your destiny. And third, be a public health ambassador. Positively impact and mentor young people who will be watching you and learning from you. Share why you chose public health and what you learned along the way. And as you flourish and grow, and I know you will in your professional career, bring others along with you. As promising public health professionals, you are change agents in your workplaces, as well as your communities. You are the champions we need in public health for a healthy, diverse, and equitable society. So as you graduate today from the Ohio State University College of Public Health, you are now a part of the public health legacy. Welcome to the team. Congratulations on your achievements today and the ones I am confident you will make in your future. Thank you.
Hi, I'm Naomi Adenia, and I'm president of the College of Public Health Alumni Society. Spring is a time for new beginnings, and I'm so happy to be welcoming you to the Buckeye Alumni family. You can count on us to support you in your new start. I hope you remember your time on campus fondly, as I remember the chimes at University Hall going off after a win, especially over the team up north. With your talents, I hope you consider actively helping our society, mentor current students, volunteer organizing our annual case competition, and supporting Dean Fairchild in her vision for the college. The future of the college is bright with you joining us. Congratulations, class of 2021.
Hello, undergraduates. This is Dr. Gail Kay on behalf of the undergraduate committee. We'd like to say a heartfelt congratulations and let you know how proud we are of you.
Yay! Amy Soder here, your career advisor, and I just want to send a special congratulations to each and every one of you. It's been an honor to work with you, to watch you prepare for capstone and go through capstone, and I wish you the best of luck with all of your future plans, and please keep in touch.
Hi, Heather Kerr, academic advisor. So proud of you, and I hope that you're all proud of yourselves for graduating during a pandemic, and that you're going to go forth into public health and do so many amazing things. We know you will. Please let us know what you do. We want to know how your futures are going.
Hi, this is Cynthia Dresch. I'm the director of the Office of Academic Programs and Student Services, and along with everyone else, just want to congratulate you. We've seen you from admissions to graduation, and we're thrilled that you are graduating. Congrats.
Hi, this is Dr. Susan Oliva, Marston. I also wanted to add my congratulations to all of you. I have had the opportunity to teach many of you in Intro to Global Public Health, and I know we are totally biased, but we have the most amazing, phenomenal undergrads, and we couldn't be more proud of you and what you are going to accomplish as you go forward. Congratulations.
And one final comment, if I may, to the moms, dads, and caregivers, congratulations to you too for supporting your children through this venture. They're not children anymore, they're young adults, and you've got much about which to be proud. So again, congratulations to all, and enjoy the time together.
Hi there, College of Public Health graduates. I want to congratulate you on finishing an amazing year. Well, amazing in that it is ending and you are graduating, but maybe amazing in other ways as well. I hope you had a great time at our College of Public Health, and wherever you're going, good luck, have a lot of fun, and keep on learning.
Hi CPH graduates, this is Julia. I just want to say congratulations on a job well done. I know you all will do amazing things after you leave the College of Public Health and OSU, but please don't forget about us.
During orientation, I welcomed you and thanked you for accepting our offer for admission and matriculating into our degree programs. And today I congratulate you for this great accomplishment. And I wish you both personal and professional success and happiness as you continue your journey forward.
Hi, Class 2021. I'm so happy to share in the excitement of your graduation, and so very proud of everyone who successfully finished your program at the College of Public Health at The Ohio State University, especially during the pandemic. Congratulations. I wish everyone the very best for your next adventure.
Congratulations to all of the graduates in the College of Public Health. I'd like to give a particular shout out to the students I've been advising, Amelia, Jenna, and Lynn, and the students that I've worked closely with over the last few years, Sarah, Michaela, and Alexis. This time of year, I'm always reminded of one of my favorite songs by Billy Joel, and that's Say Goodbye to Hollywood. And in that song, he sings, "Life is a series of hellos and goodbyes. I'm afraid it's time for goodbye again." So as you say goodbye to Ohio State, I wish you the best of luck as you say hello to the next chapter in your life.
Congratulations, 2021 graduates. We are so proud of you and excited to see what you'll do next. Please stay in touch, and you know where to find us on campus. And go Buckeyes!
On behalf of the Office of Academic Programs and Student Services in the College of Public Health, we just want to wish you all congratulations on graduation. Great job, graduates.
Congratulations. Congratulations.
Everyone has said it so well, but I'll say it again. Congratulations, graduates of The Ohio State University College of Public Health. I so wish that I could be shaking each of your hands today and meeting you and your proud families, and I'm going to hope that I have that opportunity in the future. Today, it is my sincere hope that even from a distance, you can feel the joy. It's my sincere hope that even in a virtual celebration, that everybody is feeling that joy, that you are lifting us up as a college, you, the future of public health and healthcare administration. You will be the experts helping the world navigate challenges that require rapid response and nimble thinking. You will be the advocates who drive societal change to tear down centuries-old obstacles rooted in racism. You will be the leaders who, with grace and determination, help the public understand and manage the health challenges that they must face, whether that means a new and relentless virus, long existing threats to health and well-being, or rapidly mounting threats to the environment that we share with plants and animals. As you take your place as experts, continue to look to the example of those out ahead of you, like Dr. Roberts. Thank you, Dr. Roberts, for taking the time today to share your inspiring words. And thank you for your modeling the bold, honest, and inclusive approach to public health that we champion here at the College of Public Health. And thank you, Randy and Lauren. You make me proud to say you graduated from Ohio State's College of Public Health. Proud to head into the future working alongside you and the rest of our graduates in the common pursuit of promoting health, dismantling inequities, and preventing disease. And I'd also like to thank every one of you who are taking your next step into the workforce or continuing your education. You've already shown us your tremendous strength, resilience, and passion for championing those who will go on to serve so well, who you will go on to serve so well. You've contributed to research that advances our knowledge of the world and primes us to make critical improvements. You've sounded your voices where you've seen misunderstanding, inequity, and wrongdoing. You've expanded your perspectives by listening and learning from others. You've taught others and broadened their views of the world as well, and that includes your grandmothers. Dr. Roberts, my grandmother had no idea what public health was, but your grandmothers do. You've competed in and excelled at case competitions designed to test your mettle in confronting real-world public health and healthcare challenges. You've helped your community navigate fear and anger and uncertainty and confusion through work on COVID-19 contact tracing and vaccine rollout. You rose up to a pandemic, to systemic racism, to threats that have tested our university, our community, and the resources of our public health and healthcare system like no other time in recent history. You found innovative and engaging ways to learn from your homes, to stay connected as an academic community. As you open this next chapter, you are, individually and collectively, a force to be reckoned with. You are the first generation to enter a world that truly understands public health. That comes with benefits, but also burdens in a context in which some are weary of and even resistant to our message. So we're counting on you. Be brave, be bold, be persuasive, be persevering. Be the voice for those who don't have a seat at the table, and look for ways to bring them to the table. This world needs you now more than ever. Congratulations, and go Buckeyes.